microphone. Okay, now we have microphone. Let's go back to something else. I'll deal with that later. Welcome everybody. I am your host, your KevinlyFather. We're going to take a look at the White House Coronavirus Task Force Super Duper FAUCI today. There will be questions about the Delta virus. No doubt. We should just stop calling it a variant because it's a new virus. You can catch it even if you've had the alpha or the beta or the zeta, and if you've had the zeta, let us know how it is because we have no idea. Let's see if anyone is in here. Just checking. This is a new setup. I'm working off a laptop right now remotely from the Pembroke Studios. So let me check in here. We're going to get going in just a second here. Forgive the delay. Let's see if we're actually broadcasting. And it looks like we are, but chat is not going through. Okay, let me see if I can do anything to fix that. I'm going to start let's see if the headphones are even working. I'm going to start the conference up here, and I will be messing around as we're doing this.
We've increased the daily average number of Americans newly vaccinated. And importantly, we're seeing the most significant increases in states with the highest case rates. We've more than doubled the average number of people newly vaccinated each day over the past 3 weeks in the states with the highest case rates. In fact, Louisiana, Arkansas, Missouri, Alabama, Oklahoma, and Mississippi are now vaccinating people at a pace not seen since April. And other states that have been lagging in vaccinations are also picking up their pace. Tennessee has seen a 90% increase in first shots over the past 2 weeks. Oklahoma, an 82% increase. And Georgia,
Oklahoma.
Georgia, a 66% increase in first shots over the past 2 weeks. Clearly, Americans are seeing the impact of being unvaccinated and unprotected. And they're responding by doing their part, rolling up their sleeve and getting vaccinated.
Literally.
In addition to getting more shots in arms, we are spurring action on vaccination requirements. Last week, the president announced new vaccination requirements for all federal workers and federal contractors. And he called for strong vaccination requirements from the private and public sectors to help protect lives and keep our economy strong. Already, we're seeing momentum in vaccination requirements across the country. Businesses know vaccinations are a way to keep their workers and customers safe and to keep their doors open. And today, Yelp is announcing a new feature that allows consumers to search for businesses with fully vaccinated workers or businesses that require proof of vaccination to enter the business.
Yep.
Small businesses across the country are stepping up.
I am going to start using Yelp again. I used it a couple of weeks ago. What did I use it for? Not really important right now, but really, we are here to learn things about Kevin. So,
a recent study shows that half of America's small businesses are likely to require their employees to be vaccinated. Just this week, Saffron, a family-owned business in
Saffron? Has anyone ever heard of Saffron? Oh, Mellow Yellow. That's right.
New Orleans, announced their staff is 100% vaccinated, and they are requiring vaccinations or a negative test for all their customers.
I have 2 vaccine paper cards myself. This is how it happened. Got vaccinated the first time, went to get my second shot of the Pfizer, and I forgot the paper that had the vac. So they just gave me another one. So I have 2. I could fill in whatever information I wanted on the second one. It's a completely legitimate card. But California, a couple of weeks ago, they texted me a link and said, here's your digital card. So now I have my digital card on my phone, which also makes me now lock my phone. I have to use my fingerprint to open my phone, which I've resisted because just one extra step of hassle in my life, and I try to eliminate hassle. But my phone has always been like, yeah, anything, go. For example, if I leave my phone somewhere, I'll just yell at my daughter, You're worthless and you'll never amount to anything. Oh, also, could you check my phone and see what the temperature is going to be tomorrow? You know, that sort of thing. Because I think that's positive reinforcement. I'm positive you'll never amount to anything. And I think that gives her motivation to.
Tuesday was Saffron's first night of service under their new rules, and the owner said the community response has been overwhelmingly positive. At the same time, nearly 650 colleges and universities are already requiring on-campus employees and students to be vaccinated. And yesterday, leaders of America's historically black medical schools decided to mandate COVID-19.
That's an excellent point, though. Stephanie, yes, I'd like to frequent businesses that that require vaccinations, etc. That make you show your card, your digital passport. We don't have a digital passport. That's the problem. So yes, people have fake ID cards. And apparently at Lollapalooza, there were many, many of them. So are we really safe? No. But it certainly lowers those odds, and it gives the Fox and Friends something to be really upset about in the morning.
Vaccines for all of their medical students. Nationwide, over 100 hospital and healthcare systems, including the Department of Veteran Affairs, are requiring vaccinations for their healthcare workers. In fact, just this week, more than 30 healthcare employers, including Kaiser Permanente, one of the country's largest.
I know the sign for vaccination. There you go. Boom. That's it.
Announced.
I think we all learned something today. Let's all go back to bed. Good night, everybody.
Vaccination requirements for their healthcare workers. So America's businesses, large and small, universities and medical schools, and many other institutions are stepping up on vaccination requirements. And our message is quite simple. We support these vaccination requirements to protect workers, communities, and the country. As we double down on getting more Americans vaccinated, we're also stepping up our work to help states experiencing rising cases due to the Delta variant. Our COVID-19 surge response teams are now working with 16 states to address their specific needs. We have deployed hundreds of federal personnel to provide in-person support to address a range of needs, from increased testing to getting shots in arms through mobile vaccination clinics, to encouraging more physicians to use antibody treatments, to helping states address hospital capacity issues. Let me close with this. From the beginning, we have known that this virus is unpredictable. And we have been relentless in our efforts to get people vaccinated. Our whole of government response will continue its relentless efforts to end this pandemic and deliver progress each.
I'm sorry, but since the Trump admin, anybody who says whole of government response, you're just a Mike Pounce. Don't say whole of government.
And every day.
Because it's just not true.
With that, let me turn it over to Dr. Walensky. Dr. Walensky.
Good morning, and thank you, Jeff. To keep things brief, I will simply give you an overview of the data and the state of where we are as a country. Yesterday, CDC reported 103,444.
I can't zoom in on that yet, but let me mess around. Let me see what I can do. Let's see. I'm adding another monitor today. I had something to say about that too. I'm also getting more memory for Marcy's slightly less new laptop, which she donated to the live stream, so we appreciate that. By the way, and I don't know if I said this to her privately last night or in one of the Twitters or whatever, this laptop has changed my life. It's fantastic. I was doing a voiceover yesterday, and I'm used to my old laptop with all the accoutrement, et cetera, that had to be attached to it in order to keep it slightly below the level of a Delta airplane in terms of noise coming into the microphone. That was 8.5 pounds. This laptop is 4 pounds. And just that little difference, that, well, 55% less weight, whatever it is, 57.5% less. Anyway, that has made all the difference in my life because I have to be in a closet at the TBD studios in order to record the audio. And then I go downstairs at the TBD studios where I can edit. I can sit down at a table and edit. And just carrying that extra 4.5 pounds down to that, I think that's where I got my sciatica. So this should eliminate the sciatica. Hold on. Hi, chiropractor? Yeah, I don't need my appointment tomorrow. No, it was Marcy. Yes, again. I know. This happens to them all the time. Thank you. Goodbye. Yeah, okay. Well, yeah, it's a hot one. Why does everyone always want to talk about the weather?
45 new cases of COVID-19. Our 7-day average is about 89,463 cases per day. This represents an increase of 43% from the prior 7-day average. The 7-day average of hospital admissions is about 7,348 per day, an increase of about 41% from the prior 7-day period. And 7-day average daily deaths have also increased to 381 per day, an increase of more than 39% from the previous 7-day period. We saw 614 new deaths reported to CDC on Tuesday. 83% of our counties in the United States are experiencing moderate or high transmission, with Delta variant continuing to be the predominant circulating virus. Across the board, we are seeing increases in cases and hospitalizations in all age groups. Those at highest risk remain people who have not yet been vaccinated. Now is the time to get vaccinated. We know these vaccines are working, and we know they save lives. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'd just like to spend a minute or two addressing a concern that I continue to hear regarding the speed with which the vaccines were developed. And this is usually among people who have a degree of vaccine hesitancy or reluctance to get.
This is awesome. Now, Fauci's going to come up and there's going to be a big ouchie in the face of disinformation. Somebody I was watching yesterday, it doesn't matter.
Vaccinated. It really relates to two things that have gone on that people need to appreciate. One is the logistics and the investment in resources that was made, and others is the decades of basic and clinical research that antedated the development of the vaccine. What about the logistics and the resources? Generally, when you develop a vaccine, the thing that usually takes years to do, you do it in a sequential fashion. In other words, in order not to waste money, as it were, you do something preclinical, phase 1, phase 2, phase 3, and then you start manufacturing the product. You do that sequentially because if the first one doesn't succeed, you don't want to go to the second, third, and fourth step. Because of the wise investment in Operation Warp Speed, and we give credit to the Trump administration for doing this.
There you go. There you go. Again. That's 5,000 times that Fauci or Biden or somebody else has given Trump credit for investing in Operation Warp Speed. I don't know how many times they need. It's just, it's another nonsense. It's just like, oh yeah, once it's fully approved by the FDA, oh, I'll get it. But right now, no. It's going to be, well, we don't know the long-term side effects. Oh, well, it's still experimental. It's only 1 billion people.
Particularly Secretary Alex Azar, who was an important component of that. What you did was make an investment to prepare for phase 2 and phase 3, even before you knew the phase 1 worked or not, and to start manufacturing. So when you do that, you make a major investment in resources. If the vaccine doesn't work, you've lost a lot of money. If the vaccine does work, you saved a lot of time. And that's exactly what happened. In addition, we had the clinical trial sites that we had built decades earlier for HIV and influenza, which were used to do the clinical trials. And third, unfortunately for us, but fortunately for the vaccine trials, we were in the middle of the summer surge when the phase 3 trials were initiated. So next comes the decades of basic and clinical research. both in platform technology and immunogen. It didn't start in January of 2020 when the sequence was put on a public database. The data, the experiments on mRNA approach, which was funded predominantly by the NIH and also industry was involved, started decades earlier to develop an mRNA molecule that could be used as an immunogen for a vaccine. In addition, the vector-based approach, such as the one that J&J did, was again done 10 or 20 years earlier with HIV. And the now very, very elegant work of the development of an immunogen that would be highly immunogenic to get the kind of high efficacy and effectiveness that we got was work.
If you've never listened to Imogen Heap, check her out. It's absolutely brilliant. Look up Tiny Desk Concerts by Imogen Heap. She's great. Hide and seek.
Done at the NIH Vaccine Research Center and by many of our grantees over the previous literally 1 to 2 decades. So when people say, I'm concerned that this went too fast.
If I was Fauci, I'd be, so when people say, I'm concerned that it went too fast, this is why I'm not the head of the NIH.
It did not go too fast.
That and the fact that I'm not a doctor.
It was a major investment.
Could have been under Trump. I mean, honestly, I could just say, you know, President Trump, I think you're just the greatest. And I just thank God every day. And I want to be the head of the NIH. Well, that sounds good to me.
Both in the logistics, the resources, and the clinical and basic research. So I'll hand it now back to you, Jeff.
Let me hand it over to Dr. Murphy. Dr. Murphy?
Well, thanks so much, Jeff.
President Trump, I'd like to be the head of the NIH. And did you know, and not a lot of people know this, the flu sometimes kills people. Oh, he's brilliant. Yeah, let's get rid of this Fauci guy.
Jeff. And it's great to be with all of you again this morning.
I'm proud to announce for the first time in 75 years the creation of a new government health thing. Congratulations to Kevin Williams, really a highly respected individual. He will be the new head of Space NIH.
I think we all know as cases have risen across the country due to the Delta variant, there are Americans who are wondering what this really means for them and their families. And today I want to emphasize one fact that remains true, and that is that the vaccines are working against the Delta variant. They are highly effective at preventing severe disease, hospitalization, and death, and they're also effective at reducing the overall risk of infection. In fact, a recent study in the New England Journal of Medicine found that 2 doses of the mRNA vaccines are 88% effective against symptomatic COVID-19 infection with the Delta variant. So breakthrough infections in fully vaccinated people are the exception, not the rule. And when they do happen, the vast majority are mild and asymptomatic, mild or asymptomatic. Now, this reflects the reality that we have the most effective tool we need to keep us safe and end this pandemic.
There will be no sound bites from this guy ever.
And that is a vaccine. And recognizing the importance of continuing to push our efforts to vaccinate the nation, yesterday, we brought together the 6 living former Surgeons General of the United States from the Clinton, Bush, Obama, and Trump administrations to discuss our public health COVID-19 response, with equity being at the forefront of our conversation. It was a historic meeting for a historic moment. And these former Surgeons General are public health leaders who have been friends, mentors, and partners to me in my years as Surgeon General. And we spoke about their concerns about health misinformation, about the importance of ensuring that communities of color and rural areas aren't left behind in the vaccination effort, and the power also of engaging trusted community-based organizations in vaccinations. We will continue to work together in the months ahead to ensure we continue to increase vaccination rates across the country with equity as our guide. And finally, this gathering of Surgeons General reflected the diversity of our nation, and it was emblematic of what we have to do together to defeat the virus. As SGs, we came together from different backgrounds, serving under different political administrations to work together on a path toward ending this pandemic. And we all share the belief that science and public health are what will help us protect our nation from this pandemic. So thanks for your time today. I'll turn it back over to Jeff for our Q&A.
Well, thank you, doctors. Let's go ahead and open it up for questions.
Q&A.
First question.
Yeah.
First question, let's go to Cheyenne Haslett at ABC News.
Yeah, how come you guys said that there were going to be masks, and then there were no masks, and then you said 2 masks, and then you said 5 masks, and then you said I had to mask in the shower, and I just don't want to do anything because I hate everybody. Is there a question?
Hey guys, thank you for taking my question.
Yeah.
We know that boosters are still under consideration, but there's more openness to acting on them for immunocompromised people faster. So can you tell us when can immunocompromised people expect those boosters will be available, and are there any updates?
Dr. Fauci?
Yes, thank you for that question. As we've said and continue to say, immunocompromised individuals are vulnerable. The reason is that it is clear now from the observational data that was made that they do not make, in general, with some exceptions, but in general, do not make an adequate response that we feel would be adequately protected. So in this regard, it is extremely important for us to move to get those individuals their boosters. And we are now working on that, and will make that be implemented as quickly as possible, because for us and for the individuals involved, it is a very high priority.
Next question.
Let's go to Ouija at CBS.
Thank you so much for taking my question. Dr. Fauci and Dr. Walensky have both warned that the virus may mutate and perhaps into a strain that is powerful enough to evade the vaccine. Is there any way to gauge how long before the virus overtakes the vaccine? And so we understand what that means for the vaccine. Is there a way to tweak it in that situation in order to give us protection?
Why don't we start with you, Dr. Fauci, and then Dr. Walensky, if you have anything to add.
Yes, there is a very, very long-standing tenet in virology that viruses cannot mutate unless they replicate. And so the easiest way to prevent the scenario that you're proposing could...
Hey, Chris, you didn't miss that, but you did miss that. I'll read the question out loud in case you're watching or listening and you can't see Chris's chat. Chris Wilson came in and said, late getting in, which we cannot forgive. Did I miss the part where Fauci announces all our rights are being taken from us? No. That comes, I think he says that in about 3 or 4 minutes from here. This is delayed. But he did, again, give the Trump administration and Trump credit for Operation Warp Speed. Again. So he's sort of hitting all the notes of, oh, I'm hesitant because the FDA. Oh, I'm hesitant because...
Could happen would be to get as many people vaccinated as quickly as we possibly can, to not allow the virus to continue to circulate in the community, giving it ample time to mutate. Now, not every mutation is going to result in a functional change, but every once in a while, you do get a series or a constellation of mutations that do that, and you get a functional change, the way we have seen with the Delta variant, which functionally changed because it became significantly more able to transmit. We have within our power to prevent that, and you prevent it by not allowing the virus to freely circulate, finding vulnerable targets. You protect the vulnerable targets, who are unvaccinated people, by vaccinating them. And when you do so, you do a very, very strong blocking of the evolution of variants that could be problematic.
Next question.
Let's go to Sharon Lafreniere at New York Times.
Thank you. Many experts say that the falling antibody levels that Pfizer and today Moderna cite as evidence that booster shots are needed is not convincing, because people may still be protected even with those. If that's...
Yeah, so it's in... I'm not a doctor. I do play one I played several on TV. It's like the one role that they're like, oh, middle-aged white guy, doctor. Yeah? Okay, yeah. And plus I'm not talented. But exactly. in general, once you get a vaccine for something, your antibodies go up because the body learns white blood cells, C cells, blah, 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 blah. Everybody, okay, here's some antibodies, a bunch of antibodies. Those fade away over time, but you have the memory within the cells that if your body does encounter the virus again, whatever virus this may be, the body immediately ramps up production of antibodies and you're protected from whatever that is. And that's the way, for example, it worked with the hepatitis vaccine, et cetera, et cetera. With most vaccines, it works that way. We don't really know if it works that way with COVID, and no one's going to infect somebody purposely with COVID. So there has to be more study of that. That being said, immunocompromised, definitely, yeah, get your booster shot. Now, in other countries, they're already saying everybody, booster shot, especially if you're older. So it's going to be interesting to see what's going on. I just know that as soon as they start giving away $1 million with every vaccine, I'm getting one every day. Get myself an MDA team.
So what is the right signal? Is it vaccinated people ending up sick enough to be in hospitals? And can the government wait for that kind of evidence before making a decision? And then secondly, I wanted to ask, what are the chances that the Delta
It's an excellent question. Do we just wait it out until a bunch of vaccinated people are in the hospital?
Variant will burn out, so to speak, here in a month or so, like in India and the UK?
Another fantastic question that I've been asking for a couple of weeks. So in India, the virus went way up and then it faded away in April with the heat. UK, same thing, and it faded away in April with the heat. So naturally you have a peak and then it sort of burns its way through the population, which is sort of an apt way of putting it. Morning, Fink. Is that going to happen here? That's what the virus has done in the other countries. Did we learn anything? Did they learn things? Now, both of those countries, once the virus started going uphill, oh crap, we better do things to mitigate this. Whereas here in Florida, it's just, you know what? It's just going to wash through. We're not going to do a damn thing. And when is Biden going to close the border?
Dr. Walensky first.
Yeah, we're going to make the decision about booster shots based on a compilation of evidence, one of which will most definitely be the immune responses, as you note, but that is not necessarily known to be a perfect correlate. The antibody responses, our immune system also has T cell responses. So this is going to be a combination of.
Yeah, please like or dislike this live stream. It's not even a live stream. These guys are telling the truth. This broadcast, I was watching Hal Sparks the other day, and according to him, it doesn't matter which one you press. Just they want interactions. YouTube awards interactions. I don't know if it's true or not. So you can like it or dislike it at your heart's content.
Of evidence, both of neutralizing antibody data, as well as clinical trial data, as well as our cohort data that monitor the safety and the effectiveness of our vaccines in many different populations across the country, tens of thousands of people, essential workers, healthcare providers, long-term care facilities, people who've been vaccinated early in the process. And it will be a combination of all of that evidence that helps inform our booster strategy.
Dr. Fauci, the question of the case count and
right.
Quote. Go ahead, please.
Right. So what you're asking is, when are we going to turn around this acceleration that we're currently experiencing with Delta? There are two ways you do that. You do it in the immediate sense right now by mitigation. And mitigation of the kind of things you've heard from the recommendations of the CDC regarding masking, regarding avoiding situations, crowded situations where you can have the increased capability of the virus to spread. The ultimate end game of all this is vaccination. And that's why we continue to harp on that in a very, very proactive way, that if we continue to vaccinate and we get that 93 million people who are eligible for vaccinations, who have not been vaccinated, if we do that in the immediate, intermediate.
I'm not exactly sure, and I'm trying to figure this out, because there's a little bit of delay between the sign language lady and Fauci. Well, it's actually the other way around, but it doesn't matter. I think that vaccine is just one. If you get the jab, that's just one thumb. And vaccinated in the past tense is two. I don't know if that's true. I'm just, at this point, I'm guessing, because everybody. Anyway, if anybody else figures it out or if anybody knows, let me know.
And long term, and do the mitigation right now we will turn the Delta surge around. I will guarantee you that that will happen if we do what I just outlined.
Next question.
Caitlin Collins, CNN.
Thanks so much. Several of you and the president.
Just look at Caitlin's hair. We can't see it, but I know it's perfect right now.
Have repeatedly cited figures saying that 99% of those who die from COVID-19 are unvaccinated, and 95% around that who are hospitalized are unvaccinated. With the Delta variant, do you still stand by these numbers, and do you have government data to back them up?
Dr. Walensky.
Yes, thank you for that question, Caitlin. So those data were data that were from analyses in several states from January through June and didn't reflect the data that we have now from the Delta variant. We are actively working to update those in the context of the Delta variant. I do want to reiterate, though, that based on the data we're seeing, and we don't have fully updated numbers, universally, as we look at our hospitalizations and as we look at our deaths, they are overwhelmingly unvaccinated people.
Next question.
Let's go to Tamara Keith at NPR.
Thank you for taking my question. There's some reporting out there that the working groups that are looking at reopening some international travel are making plans to require vaccination for international visitors. I'm wondering how that would work, whether it would be simply an attestation as with federal workers, or whether there would be a more rigorous form of vaccine verification. And on vaccine verification, you talk about that restaurant and other businesses that are requiring their customers to be vaccinated. How are these businesses supposed to do vaccine verification? Is it Wild West out there, or are there guidelines?
Why don't I take the first
It's Wild West.
question on travel and Dr. Murthy, vaccine verification.
Well, some states have gone to a method where they are cooperating with private entities and creating a digital version of the vaccine card, whereas other states have made it illegal to have vaccine cards. And some states, you do have, it's called the hybrid program, where you have that piece of paper, some sort of thing that just says vaccine on it, and as long as it's not written in crayon, it's acceptable.
In terms of travel, and I'm glad you asked.
In Florida, crayon also is acceptable.
That question.
But it's illegal to ask or use crayons.
The administration certainly understands.
We want to leave it up to the families to make the decision whether or not to give their children fake ID cards.
Understands the importance of international travel. And given where we are today, as Dr.
No, you got to be careful here. DeSantis is not against vaccines. He's just against using the vaccines.
Walensky showed us earlier on the prevalence of the Delta variant. The United States will maintain the existing travel restrictions at this point. However, we do have, as you alluded to, agency working groups that are developing plans for when we do open travel. How do we do it in a consistent and safe way? And part of that planning is a phased approach that foreign nationals traveling to the United States may, there's still policy work being done here, may need to have some type of vaccine requirement, but that's not a decision at this point. That's one of the paths that's being looked at. And
we're just going to make them have Yelp on their phone when they get here.
Considered, but there are alternative paths being looked at the same time. So,
by the way, if you're joining us late, the biggest news that's come out of the conference so far is that Yelp, the review app that you can get on your phone or online on the web, on a browser, Yelp is going to start having some sort of badging as of today that lets you know if a local business demands that its employees have the vaccine, or if it requires you to be vaccinated to visit the restaurant, hardware store, etc. So that'll be interesting to see how that rolls out.
The interagency working groups are currently developing.
And that's something I will start using the Yelp app again. And that's something where, oh, you know what? Let's eat out or whatever. Eat out. I'm not going to eat out. I'm going to go to the restaurant and pick up. the Delta variant is just too unpredictable. And now we've got the Columbia variant, and now we've got the Lambda variant, and Columbia, as far as I know, doesn't even have a name yet. But there are at least 2 strains coming out of, and again, let's just start calling them the virus. So we've got the Delta virus. These are separate entities, and you can catch COVID twice. You can catch the Alpha virus twice, but you can actually have the Alpha variant and the Delta variant at the same time. They've mutated. So now this is no longer COVID-19. This is a completely new COVID. And when I say completely new, meaning that your body reacts to it as a new virus. So we should stop saying variant and we should just say the Delta virus.
Developing a policy process, and we will be ready when it is the right time to consider reopening travel, and that'll be guided, as always, by the science and the public health. Dr. Murphy?
Sure, and let me just ask, can you repeat the specific question you had on the verification?
Sorry, I had trouble unmuting myself.
It's okay.
Welcome to 2020.
The question is, you guys have talked about restaurants or other private businesses having only vaccinated.
Like literally at the beginning of this live stream today, this broadcast today, I was mute. So I'll adjust that. I have these little headphones that I could use, but the speaker thing doesn't work on them because I put them through the wash, and apparently Bose headphones, if you put them through a wash, the microphone stops working. Come on, Bose, get your act together.
Vaccinated customers, how's a mom and pop shop supposed to know how to do vaccine verification?
Yes, good question. They can use Yelp.
Yeah, it's a good question. Well, the good news is that we have seen a significant movement in the...
Okay, no. I don't want to hear the good news. I want an answer to this question, please.
The private sector to develop...
Just be honest with us. Yeah, well, unfortunately, they have to go on the honor system. There's a lot of fake ID cards out there. From the very beginning, this administration was hesitant to create a vaccine passport of any verified manner because they were afraid of the optics from Fox News. And so really, Rupert Murdoch is running this country. Next question.
Essentially vaccine verification efforts. We know this is not something that the federal government is leading, but we are happy to see the private sector leading and taking in.
Yeah, we're the federal government. We're not doing this. The states have to do this. This is another,
initiative on that. And, I think this is going to be increasingly important because we know that more institutions are considering vaccine requirements. We certainly have seen that in the healthcare system, the vaccine requirements for healthcare workers is being adopted by more and more institutions, and we expect that will continue.
Next question.
Okay, that didn't answer the question at all. Might as well have been about soccer.
Maureen Grappi at USA Today.
Hi, thanks for taking my question. I wanted to ask about the federal assistance being offered to states that are hit hard by COVID. At one of the White House briefings this week, Jen was asked if the offers have been accepted in Florida and Texas, and she called that a, quote, discussion. Is there any update on that, on whether Florida and Texas want any of the help that the administration is offering?
We are working with 16 states, and I believe there are conversations with Florida. I know there are
so a third of the states.
Conversations with the state of Florida, and I believe there are some conversations with Texas too. But that let me come back and verify that. But we're working with 16 states at this point on testing, on increased vaccination through mobile clinics, the increased use of therapeutics, also assessing and helping out on hospital capacity. So
that's by the way, that's on the states. It's not the federal government saying, no, we're not going to talk to more than a third of the states at a time. Come on, there's 50 of you guys. It's just ridiculous.
16 states across a whole range of areas. Next question.
All right. We have time for one more question. We'll go to Meg Tyrell at CNBC.
Thank you. This is a question for Dr. Walensky, I think. Last week in the slides we saw from the CDC, The CDC noted that Delta may cause more severe disease than older strains and cited some evidence from other countries. I'm wondering, does CDC think the data show it does cause more severe disease? And also, how are you looking at the risk it poses to children? Do you see more severe disease from Delta for them?
Yeah, thank you for that question.
Yes. Yes is the answer from all of the anecdotes and antidotes, which is what a vaccine is. It's not. I mean, kind of is. Anyway, just anecdotally, doctor after doctor after doctor has been on the Twitters, and I only trust the verified ones, and on the news shows, etc. And as long as they have a lab coat on, that's official to me, saying that their children's hospital is full. That just wasn't the case the last time around. And there are stats, of course. It's 75% increase week over week in children underage, and it's for the most part, for the vast majority, it's the unvaccinated kids. And of course, 12 and under in this country, you can't get vaccinated. Ted Cruz was on one of the morning shows, or what? I saw a clip. It must have been this morning that Ted Cruz was on CNBC, and everyone should have that choice. Everyone should have a personal choice to get to anything. Everything should be about choice. Okay, what about people who aren't vaccinated? Well, that's their choice not to get vaccinated. Well, kids can't get vaccinated.
Meg, certainly in that slide deck, there were some early preliminary studies that suggest that Delta may potentially cause severe disease. We continue to monitor this, not just in adults, but also in children. But I do want to highlight a couple of things that
more severe disease is what she said, should have said.
Continue to confound some of the data, and that is we have an enormous burden now of disease, so exposures are much higher, and the mitigation strategies that were used last summer, even in the winter,
I just discovered something.
Have not been employed in many of these areas that we are having surges right now. So we're working to understand the differences between exposures, and as well as the severity of disease, and working to confirm those preliminary data that might suggest so.
Good. Well, thank you.
I got to work on my Ted Cruz impression. I know that, but I have been for years now imitating at random's lifelong smoker aunt from Brooklyn.
And look forward to briefing early next week. Thank you.
Well, thank you for joining. And that goes for everybody out there. Let's take a quick look here and see if the White House press briefing is up and running. Let's go to White House here on the YouTubes, and press briefing live now. So that's going to be coming up in a little bit. What did we decide yesterday with the press briefings? That we have to delay them a little bit? Here's what we'll do. I will, let's see if C-SPAN has an updated time on this. Let's go to CSPAN, stop it. There we go. And CSPAN says, no information there. There's going to be a White House Transparency Act. We might talk about that later. Senate votes on amendments to the $1.2 trillion bipartisan infrastructure bill. Amendments are how senators sabotage bills. So that's going to be a long process. And one of the senators, and I forget who it is now, Mike Lee, somebody said we're just going to have nothing but amendments until the August recess. So that's just going to sabotage the whole thing. But that's part of the plan. I don't know if that's happening or not. We'll take a quick look at that. So the COVID happened 1 p.m. Eastern, which is 10, it's more than a half an hour from now. So what we'll do is we will take a break, step down, and I will create another link, another broadcast for the White House press briefing if you want to join us for that. That will be broadcast on YouTube, so we don't have to start right on time. And they never start on time either. I'm guessing probably 10:15, 10:30 Pacific time. So get yourself something to eat, get yourself showered and shaved, and we'll do that in a little while. But first, let's just check in on the senators and watch the exciting amendment process. Please don't play an ad.
Or
there we go.
I suggest the absence of a quorum. clerk will call the roll.
Oh, Jesus Christ. Right away, we come in on Chuck Grassley, and he suggests an absence of a quorum. The Senate always has a quorum. Okay, in the Constitution, you have to have a quorum. A quorum is 51 senators. Okay, just a simple majority. In the United States Senate, a quorum is considered 51 senators. The Senate never has 51 senators there. They just don't. But everyone always operates in the Senate under the assumption that there's a quorum. Okay, but if you really want to slow things down, you call for an absence of a quorum. Any senators can do that. And once a senator, like Chuck Grassley says, absence of a quorum, then they have to do a roll call. And they have to continue the roll call until there's 51 senators that have been accounted for. So either the senators have to sit in there and wait instead of being in their offices or doing their job elsewhere, et cetera, because this amendment process is just silliness. So the senators have to walk down the hallway or come from wherever they are. The senators' offices are predominantly in the Capitol building itself, not in the adjuncts, but anyway. And there's going to be a roll call. Now, this is what slows everything down. So basically, Chuck Grassley is just being Marjorie Taylor Greene in the Senate right now. So now they'll go alphabetically. And I would have no problem with this because my last name is Williams. So I would never have to show up for a quorum. But if you're Senator Anderson from Wisconsin, doesn't matter if you're from Wisconsin, you got to be close by just waiting to go in for the quorum. Let's see who's... This is C-SPAN, so we can't pause it. It just skips ahead.
On January 6th, Congress got a first-hand reminder of a
this is what's happening. This is Mitch McConnell. They're playing stuff from earlier, and they're used to this because senators, during the amendment process is just about slowing things down. These are about people trying to sabotage what 80% of the American people are in favor of. By the way, who are the 20% that are like, oh, no, potholes? Love them. Please. Crumbling bridges? I'm a thrill seeker. I like to know that every time I drive across that river might be the last time. Plus, I didn't shower this morning. Who are those people? Now, boy, one thing I hate, infrastructure. Can we talk about the infrastructure weeks under Trump, by the way? Never happened. 4 years in office, all about I alone can fix it. 4 years in office, not a single committee hearing. Oh, well, it was being blocked by the No. Not a single committee. Now, a committee hearing doesn't have to have a vote. It just has to have the White House or anybody saying, hey, infrastructure committee, hey, judicial committee, hey, transportation committee, in either the House or the Senate. Here's what we would like. They never even proposed any kind of infrastructure deal, ever. It never happened in 4 years. Promises made, promises wept. All right, guys, we're going to stop down. We'll be back in a little while. We'll probably cover the White House press briefer again today. Oh, it's Lindsay. Lindsay's the one who loves the potholes. And the sinkholes. Good point, Marcy. Reason number 755 not to live in Florida. But the nice part is nobody's going to be living in Florida for long. Okay, guys, thanks for joining us. We'll be back in a little while. I guess subscribe on YouTube if you're watching on YouTube. Otherwise, keep an eye on my Twitch and or Twitter, and I'll try and update them as we go forward here. Thanks for watching. Be good to yourself, but you know what? Don't be good to others because you don't have time. We're going to be back in just a little while.